Hi everyone, Michelle here from Allegany County Department of Health. I hope you had a wonderful weekend. So we're back to answer some more questions that individuals have about the COVID-19 situation. So today we're going to be talking a lot about how the disease spreads, we're going to be talking about testing and some of the news that our county got this weekend in regards to the testing. So let's first talk about the spread of the disease. So it seems like it's most contagious when symptoms are present. There does also look like, though, that there have been some cases where the individual had mild symptoms and was contagious a little bit prior to that point. Typically, symptoms are appearing 2 to 14 days after exposure, though. So remember, what you do today could impact you 2 weeks in the future. Another question was, should I wear a mask? So the CDC does not recommend wearing a mask at this point unless you have the disease or another respiratory illness and you're going to your doctor's office. For everyone else, carry around Kleenex to be able to cough and sneeze into. Use your arm if you absolutely have to, but continuously wash those hands. If you've traveled recently, especially to a CDC level 3 country, we want you to stay home for 14 days and monitor your health. So a CDC level 3 country, there's several of them. You can look on their website, but those are countries like China, Europe, UK, Japan, South Korea, so on and so forth. But again, stay home. Watch out for those signs and symptoms. Call your doctor if you start developing anything. Pregnant women. Pregnant women are always usually in that susceptible area. This is a new disease, so we're not exactly sure how susceptible they are, but knowing that pregnant women are typically more susceptible to viral infections, again, we recommend that these individuals stay at home as much as humanly possible. Okay. Going into testing. So Governor Cuomo recently came up with some criteria for testing. So close contact with a known case, people who have traveled to a CDC level 3 country or level 2 that have symptoms, people who are under direct quarantine, people ill with fever and respiratory illness with no other explanatory diagnosis, or if the healthcare provider, local Department of Health, and the New York State Department of Health agree that testing is required. So those are right now the criteria for testing. In regards to our news for the county, you may have heard the very good news that this 37 tests that we did for the Department of Health last week all came back negative. So one, that's awesome. Two, there was a little bit confusion because we reported 37 negative tests came back, but then there was a table that posted about 42 negative results. So know that the 37 were us. The other 5 were from providers, healthcare providers in the area that were doing testing. We're not tracking. We don't always know when those providers complete those tests or do those tests. We just see them when they come back as negative or if they were to come back as positive. Those individuals, the 37 and their families who were all in quarantine, they're going to be released on a case-by-case basis. Remember, quarantine is usually when somebody was in close contact, but is not showing symptoms. Isolation is when they're showing symptoms. So we want to make sure before we release them that nobody in the household is showing any symptoms. Makes sense. All these negative tests, though, might have you feeling like a false sense of safety. I think even I got that, like, okay, is this getting better? No, it's not. This is just the beginning. Really, you can't lighten up now. This is not the time to go out and go celebrate at the grocery store. Really, this is the time to really start hunkering down. Wash your hands, keep your social distance, keep, that shelter in place mentality. So If you don't know, the governor released his pause plan. So 100% of non-essential workers, he wants to stay home. All of us else, or everyone else, it's essential. You know, we're going to work, we're still keeping social distance. But some things to remember is, yes, we're still allowed to go to the grocery store, get gas, but try your absolute best when you have to go, get all the essentials that you're going to need so that you don't have to go back out for a while. You don't want to make your trips every day, probably once a week at the most. So do that just to reduce your exposure and your exposure to other people. Limit who goes to the store with you. The whole family shouldn't go. Designate one person, you know, the person you don't like the most. It doesn't matter. But yeah, let's keep our heads up, keep smiling. It's just the beginning. We'll get through it. And do your part. Do your part. Wash your hands. Keep your distance. Okay? If you have any questions, again, give us a call or send us an email. We'd love to answer them. Thank you. Bye-bye.